Well, have you been waiting days or even weeks to hear from your doctor about scheduling that procedure or maybe getting your prescription? Turns out you are not alone.
Yeah, and it may not be your doctor you're waiting for, but your health insurance plan. Most insurance plans have prior authorization rules. The problem is it can delay your care, and in some cases, the prior authorization is for basic things like diabetes medications.
But here's the thing. There is a bill before the state legislature to speed up that process. Monica's here, our senior health correspondent, to kind of break this down, explain to us what this means and how it's going to affect us or trying to make an appointment.
If you have health insurance, it affects you. So prior authorization, sometimes called pre-certification or prior approval, is a way health insurers control costs by requiring healthcare providers obtain advance approval before a healthcare service or medication is given to you, the patient. Now, there is a bill pending before the Ohio legislature that would give what's known as gold card status to physicians who typically get about 80% of their requests approved. There are about 30 states working on this type of legislation. About a dozen of them already passed it. Now, while the issue is a paperwork headache for doctors, it can be a serious issue for patients.
What prior authorization ultimately creates is delay in receiving care. And when you experience those delays, when you're in pain or have inflammation or in discomfort, in the case of my rheumatologist and my RA experience, that delay means risk of joint damage. And once you incur joint damage, you really can't reverse it.
So Sean wants to see Ohio House Bill 130 pass. It was introduced in March. It's currently in the Insurance Committee, but if it's passed, it would essentially give that gold card status to physicians and other healthcare providers who have 80% of their requests approved by insurance companies, a 12-month exemption from having to go through the prior authorization paperwork. The Ohio State Medical Association says doctors' offices on average spend about 13 hours a week filling out that paperwork to get procedures, devices, or drugs approved for patients. And that's all through their health insurance. And what they're finding is it's not just the expensive surgeries that are second guessed. It's also simple things like Tamiflu or diabetes supplies, which can force patients to wait days or weeks before they get approved.
So I think one of the questions that comes up is, didn't the Affordable Care Act address this issue?
Yeah, we all thought that, didn't we? Yeah, no, the Affordable Care Act actually requires that people have access to affordable health care coverage, but it does not prohibit insurance companies from using cost containment methods. They consider it a system of checks and balances to curb their costs. The problem is sometimes it takes days, weeks, or even months for a request to get approved. So it's not denying care, it's delaying care. But when you're talking about a cancer patient or someone with diabetes, waiting any amount of time can actually be life-threatening.
Right, yeah, that makes sense. Thanks, Monica.
Sure.